Welcome to Living Healthy Chicago. Thank you so much for joining us. All right, making sure your doctor is updated on how you're feeling is important at all stages of life, but that can be especially true for women who are expecting. This next woman says speaking up to her doctors helped her with a serious pregnancy disorder.
I asked my mom if I could go out and play.
Moments like these are extra special for Siobhan Davis.
I'm more appreciative of those moments because it could have been a possibility where we didn't have those moments.
That's because after she became pregnant with her second son, she knew there would likely be a long road ahead of her when it came to her health.
With my first child, I had him at 30 weeks. So he was very tiny. It took me a long time to even want to get pregnant again because I knew my experience before. And I knew that I was going to probably experience the same thing with this pregnancy, so I was worried.
Preeclampsia is a hypertensive disorder pregnancy. In fact, it's the commonest medical complication that happens. About 5 to 7% of all women develop preeclampsia worldwide, and it is characterized by high blood pressures and proteinuria and actually involvement of multiple different organs, including brain, liver. People don't really know what causes preeclampsia. So first of all, if you're first time pregnant, obesity, African American race, history of chronic hypertension.
When I went to my doctor's appointments, they noticed the protein in my urine. Because I already experienced preeclampsia, I knew what to look out for, and that was important.
She came in knowing what she was dealing with. She's very committed. She came for all her appointments.
I kept educating myself. I monitored my blood pressure. I just wanted to make sure I kept on top of things so it didn't go south or I didn't have a bad outcome.
Siobhan also made a point to change her eating habits.
I did try to manage my diet, eat a lot of fruits and vegetables, foods that aren't processed.
Try to modify all your other cardiovascular risks so that preeclampsia kind of is the only risk because that can't be modified, but you can work on other modifiable risk factors. Eating heart healthy, taking care of your cholesterol.
Just because I knew the seriousness of preeclampsia, I just stayed on top of it.
Dr. Rana says ultimately the best form of treatment is delivering the baby.
Delivery kind of halts the process of this kind of ongoing endothelial dysfunction. So if you have preeclampsia that happens at term, so after 37 weeks, the treatment is immediate delivery. If you have preeclampsia happening before 34 weeks, for example, we do sometimes try to manage the patient's inpatient, checking their blood pressures, looking at the baby's growth, to try to push the pregnancy to 34 weeks.
Siobhan worked closely with her doctor to monitor her symptoms and ended up delivering her son at 36 weeks.
After I had him, things seemed to go back to normal, as normal as it can get. The baby turned out good. I ended up being okay.
And while Siobhan and her son were able to go home, she continues to work closely with her doctors to monitor her health.
Preeclampsia kind of the damage can continue even years later in life. So women who have preeclampsia have a very high risk to develop cardiovascular disease, so such as MI, even stroke. So we have to follow these patients all the way out.
I'm doing pretty good. I continue to monitor my blood pressure.
But Siobhan isn't letting that keep her from focusing on family time.
I'm very appreciative of the moments that we have together. To talk to him, sing him a song, read books to keep him calm.
Both Siobhan and Dr. Rana agree that awareness is key when it comes to preeclampsia.
Be involved in your care and ask a lot of questions. Ask about preeclampsia. Am I at risk of preeclampsia, and what can you do to reduce the risk?
Stay dedicated to your health. Stay educated, keep your doctor's appointments, and just report anything that isn't right. It's worth it in the end.